Hi, my name's Simon. I'll be the nurse practitioner today. It looks like we're going to be doing a physical assessment. As I'm going through, I'll explain everything that I'm doing. If you feel at any point uncomfortable, if you have any questions, please feel free to ask me or let me know. This will require me touching you. So before beginning, do I have your permission? Yes. Great. So what I'm doing is I'm looking at the skin, your arms and your legs, making sure that they're uniform in color appropriate for your ethnicity. I'm also looking for any markings, any abrasions, and I don't see any bruising of any sort. With the back of my hand, I'm just palpating, and what I'm feeling here is for uniform temperature, warm, dry, and intact. So that is healthy skin. I'm going to check for skin turgor. I would check on both sides, but I would check for tenting, making sure that there's no tenting, that it snaps back with elasticity, so that's good. Your capillary refill, I would check each. And what we want to see is a capillary refill of 2 seconds or less. That just indicates proper perfusion throughout your limbs. So those are all great and healthy. I'm looking at your head now, and I'm looking for a normal cephalic shape, which just means that it's normal, appropriate for your body and your uh, height and size. I'm going to now palpate, and I'm feeling for any lumps or bumps. Don't feel any abnormalities. It's uniform, symmetrical on sides. I'm going to take some hair, at least 50 strands, and I'm going to do a pull test. And so here, what I'm doing is ensuring that there's not a lot of shedding and that the hair texture is uniform and it is even throughout. So we are good there, great hair. The next thing we're going to do is move on to the eyes. So I'm going to shine a light briefly into both eyes, and what I'm checking for is the pupils. I want to make sure that they're both equal, reactive to the light, and that they're round. So what I'm looking for first is the pupils. I'm going to shine a light. There's one and the other. That's great. They are both equal, round, and reactive to light. And I'm going to now ask you to focus on my finger, and I'll ask you to just keep your eye on it and follow that with your eyes. Checking for accommodation, and we're good. Sometimes it feels a little funny, but normal reaction there. So I'm also looking at your eyebrows, your eyelashes, the eyelids, making sure that those are all uniform. There's no redness, no exudate, which just means that there's pus or anything like that. And I don't see anything like that, so that's great. Before moving on to the ears, what I would do is if I had my ophthalmoscope, I would take a look at each eye for the retina at the back, ensuring that it's pink and that there are sharp margins, which would indicate healthy eyes. Now I'm going to move on to the ears. So with your ears, I would check both sides, and I am just feeling around, making sure that the auricle or the outside of the ear, there's no pain or tenderness, no abnormalities, that it's symmetrical on both sides. And I would feel the tragus, which is the little nub here. Yeah, I notice you have a piercing on the right. Any pain or tenderness? Great. And the mastoid behind. Any pain or tenderness? Good. That that's great. So now that we've completed the outer ear, if I had my otoscope, what I would do is first take the ear and pull up and back, straightening the ear canal. And I would want to look to make sure that I see a pearly gray tympanic membrane, no holes or perforations. And I would also, on each side, want to see a reflection of my otoscope, the light. On the right side, I'd want to see it at 5 o'clock, and on the left side, I would want to see it at 7 o'clock. So that would indicate healthy ears, which is great. With the same otoscope, I would take that otoscope and I would ask you to slightly bend your head back, taking a look at the nares. On both sides, I do notice a deviated septum to the right there. Any issues with breathing?
No.
Great. Otherwise, it looks pink, mucosal, no active draining or bleeding, so that is a good sign for your nose. I'm going to palpate here on the sinuses and check for any pain or discomfort.
No.
Great. Moving on now from the nose and the sinuses, I'm looking at your lips and I'm noticing that they are pink and uniform in color. There's no dusky or blue, which could indicate a problem with oxygenation. I'm going to ask you to open your mouth and say ah, taking a look at the back of the throat, ensuring that there's no exudate or drainage. I would look at your tonsils, but you don't have any. So I would want to make sure that they're uniform and not too enlarged. And I'm also looking at the tongue, and I'll ask you to lift that up. Great, thank you. And uniform in color, pink, no lesions. Your teeth are all intact. They look great. Your gums look healthy and pink. And that is wonderful. All right, moving on now from your mouth, we're going to go to the neck. Ideally, I would have you sit back at least 30 degrees. And I would ask now that you turn your head to the left. And here I am looking at the jugular vein, making sure that it's not distended. If it were distended, that would cause some reason for alarm, but I don't see that it's distended, so that is good. Next thing I'll ask is that you tilt your head back, and I'm looking at the trachea. So the trachea, I want it to be midline, and I see that it is midline, that it's not deviated to one side or the other. I'm going to step around behind you, and I'm going to now feel for the thyroid, and I'm going to ask that you swallow. Great. And I'm just going to move back and forth, and I'm checking to make sure that there are no lumps or hardness. So we're good there. No abnormalities with the thyroid. Before moving on, I'm going to go ahead and check the lymph nodes, the preauricular, the postauricular, the parotid, tonsillar, submental, submandibular, superior and deep clavicle, and the supraclavicular down here. And I'm just making sure that there, again, are no hardness or stiffness, that they're able to move around and that they're not enlarged. I didn't notice anything there, so all good to go on those. Before moving on from the neck, I'm going to take a listen for any breweries with my bell here. And breweries is just another name for coarse sounds. I don't hear anything abnormal, so that's good. Moving on from there, we're going to take a listen to your heart. I would want to check the precordium. Oops, I'm sorry. At the bottom of my hands. And I'm making sure that there's no distension, nothing abnormal. And now I'm going to locate the fifth intercostal space, walk my fingers down, and I want to check the point of maximum impulse. That's felt. So good. And I'll take a listen to the apical pulse, which is actually at the bottom here. I would want to listen for 1 full minute, but for time's sake, I'll just give a brief listen. Listening for S1 and S2, the love dub sounds, no murmurs or any other adventitious sounds. That is good. Now I'm going to take a listen to the different points of the heart, the aorta, the pulmonic, the Erb's point, the mitral valve, and the tricuspid. So, ideally, I would listen with the diaphragm and the bell for 1 minute, but for time's sake, I'm just going to give it a listen, starting with the aorta, pulmonic, Erb's point, tricuspid, and the mitral. Great. Nothing abnormal heard there. At this point, I would have you, if we had a proper table, roll onto the left side, and I would check the mitral valve with the bell of my stethoscope. that would just allow me to hear that better. I'm going to ask that you lean forward, and I'm going to take a listen with the diaphragm, the aortic, or the aorta, and that just allows me to better hear for abnormalities. Nothing noted there. Nice, good lub-dub sound once again. From your heart, I want to check the carotid as well. I want to do that one at a time. Great. We are normal there as well. It's a nice normal pulse. It's not bounding or too diminished. Now what we're going to go ahead and do is I'm taking a look at your chest, and I'm going to go ahead and just feel the chest wall and make sure that there are no abnormalities there. I'm watching you breathe. I don't see that you're labored in breathing. Let's start by taking a listen at the top of the lungs. And I'm going to start at one side and move my way across. And make my way to the bottom of the lungs here. Again, checking for any adventitious, any wheezes, any crackles. I don't hear any of those things, so that is good. Next, I'm going to ask that you lean forward just a little bit. I'm going to take a listen to the backside, again, starting from the top, working in a ladder pattern zigzag on the way down. And again, I'm checking for any wheezes, crackles, any abnormal sounds. Everything sounds uniform, nothing abnormal. I'm going to now percuss with my fingers, 2 fingers, and what I'm listening for is a uniform thud sound. And I don't want to hear any hyperresonance. This could indicate an issue like fluid buildup, but that's not noted, so nice, good sounds there. Next, we're going to go ahead and check your pulses. So I would start by checking the radial on both sides, and I would check both sides with the brachial and the popliteal, which is behind the kneecap. And I'm going to check the posterior tibial and the pedis dorsalis, the top of the foot. And those are normal. We already checked the carotid. All of those were great. +2, which just means that it is a normal pulse, that it's not bounding or too throbbing or too diminished. So we're good on those. That completes the assessment, but before ending, do you have any questions for me?
I don't think so.
Great. Well, thank you so much for your cooperation.
You're welcome.